Hey everyone, welcome to another video. In today's video, we're going to be talking about an injury that most of you probably have heard about and may know someone or have experienced yourself, which is the ACL injury. So the ACL or anterior cruciate ligament injury is quite daunting and challenging if you've suffered from one, and the process for rehabilitation is often quite long and requires a lot of patience and determination. But with the right approach to recovery and rehabilitation, you can definitely go back to achieving what you have been doing beforehand and even more. So in this video, we're going to go through a couple of different options for management after you have had an ACL injury, and I'm going to go through and talk about what considerations to make regarding each one. I'll also talk about a few research outcomes that you might want to consider before making up your mind about which pathway to take on your ACL journey. So make sure to stick around for that. Let's start with talking about what the ACL does for the body. So it's a crucial ligament that helps stabilize the knee by stopping excessive forward movement of the tibia, which is the lower leg bone, relative to the femur, which is the upper leg bone. Injuries to the ACL can occur from sports that require a lot of direction change, pivoting or twisting, or jumping and landing. And recovery from an ACL injury does require a lot of patience and determination, as well as guidance to get through your rehabilitation safely. And if you suspect you have injured your ACL, it's definitely a good idea to seek help from a professional, whether that's a GP or a physiotherapist. They can assess you and determine whether you need to be sent for further scans, such as an MRI, to completely rule in or out the injury. For your reference though, the really common symptoms that people will usually feel with an ACL injury is a pop that they might feel or hear in their knee at the moment of injury, as well as swelling and pain that comes almost immediately afterwards. The really telltale sign is the feeling of the knee being unstable, and the feeling of instability is usually quite subjective, but I would generally describe it as not being able to trust your knee to put your full weight on it without the knee buckling. And this feeling might be more or less depending on the severity of the injury, but it's usually there with a complete ACL rupture. And so once you have had confirmation that you have injured your ACL, there are a couple of options for management to consider. I'm going to go talk through each one now, and we'll go through some of the considerations to think about, as well as some pros and cons of each towards the end of the video. And so the first option is to have the ACL repaired through surgery, and this is known as the ACL reconstruction. This has been probably the treatment of choice for a lot of people for quite a long time. It has been around for a while, and there's really good research around it, and the technique for surgery has been evolving over the years. Traditionally, it's definitely offered to people who perform at a high level of sport and are looking to return to that. And often the surgeons recommend that you go to a physiotherapist first to start something called Rehab, which is just the initial part of the treatment, which would help focus on reducing knee swelling and improving your knee strength and range and function prior to surgery. This usually gives people a leg up on the initial recovery after surgery, and generally will be useful for everyone. The current trend for ACL surgeries is to use a technique where they use a hamstring graft, which is where they strip part of your hamstring tendon and form a bridge between your ACL stumps, if you have had a complete rupture, and connect them with that. And what this means is that immediately after surgery, you're actually dealing with an injured hamstring as well as a recently repaired ACL, which isn't quite as strong as what it should be. And so for the first couple of months, about 9 to 12 weeks, there's still a risk of re-injury to the ACL during your rehab, which you need to be careful about. With the hamstring graft, it also changes some of the things you're allowed to do straight after surgery. You're not allowed to stretch your hamstring too aggressively in case there is further tearing of the hamstring, just because they have taken a graft out of it. But once your surgery is done, your rehabilitation can start straight away. And you're really looking at 9 to 12 months of rehab. This is about the time frame across the board for each option anyways, but the rehab is really important to get you back to full function and full fitness, as well as returning to any sort of activities that you want to be doing, whether that's recreational or semi-professional or professional. Everyone's journey is going to look a bit different, and so it's always a good idea to get in touch with your physiotherapist so that you can get assessed and that you can get an individualized program tailored to you. And this video isn't so much about what the rehabilitation is going to look like. If that is something that you want to see, leave me a comment down below and I'll work on getting a video up about that. So before I get into the pros and cons of surgery, I'm going to talk through the other methods of management before we discuss all the pros and cons together, just so I can keep that a little bit clean and fairer. So the next option to consider is the non-surgical method, which is usually called the conservative management approach. Pretty much what this is that you skip the surgical step altogether and you jump straight into rehabilitation with a physiotherapist. You're still looking at 9 to 12 months of rehabilitation, and the goals are still the same of reducing swelling, increasing your range, increasing your strength and function, and returning to activities such as sports. And so you might be wondering, what is the difference? The biggest difference is obviously that you're not going to be undergoing surgery. So the trauma of that / the hesitation about going to surgery for some people, that can be avoided. The ACL itself obviously is not going to be like if you have had surgery. So it won't be repaired, but we're going to talk about a method later on where there might be a chance of it healing. So the conservative approach still requires about your 9 to 12 months of rehabilitation, and it's definitely an option for anyone who doesn't really feel keen on going under the knife. And so you might be wondering, what happens to the ACL in this case? In this case, generally speaking, the ACL remains injured, and while we talk about the ACL being a very crucial ligament that helps stabilize the knee and stops the excessive forward translation of your leg bones relative to each other, the body is really amazing, and you can train your muscles, your quads, your hamstrings, your calves to compensate and take over for the ACL, for the injured ACL, to stabilize the knee and help restrict that translation. And so one of the ways to do this is really to focus on your rehabilitation to strengthen the knee muscles. It can get to a point where people are very functional with walking, running, jogging, even sports, where their knee muscles are strong enough to help stabilize the knee without the ACL actually being intact. However, in saying that, it would still be lacking comparing to a knee with an intact ACL in activities that require a lot of change of direction, pivoting, twisting. There is still a limitation there. In saying that, there's a good percentage of the population for which this conservative approach is very viable, and they can return to all the activities that they were doing prior to their injury and possibly more without the need for surgery. Now, the knowledge and understanding around ACL injuries has definitely been evolving over the decades since about the 1970s. And I spoke about how the surgical techniques have evolved over time, and they continue to do so. The option of a conservative management approach would have been inconceivable probably like 20 to 30 years ago, but it is now one of the main ways to manage an ACL injury. And this brings us to the third option of managing an ACL injury. It is very new compared to surgery and the traditional conservative approach that we just talked about, but it does offer a slightly different pathway for anyone who wants to avoid surgery, but also have the chance to have their ACL intact again. What this third option is to give the ACL the best chance to heal, and it's done via something called the cross-bracing protocol. It's developed by a sports physician called Dr. Tom Cross in Sydney, and the idea behind it is underpinned by some new and really promising research about ACL's ability to heal. Probably 10 or more years ago, we would have been taught that ACLs don't have a chance to heal because it doesn't have very good blood supply. And now research has been showing that actually there has been spontaneous healing of the ACLs in certain cases, and the cross-bracing protocol allows for the most optimal chance for that to happen. Now, the protocol locks the injured knee into a brace for 4 weeks, locked at 90 degrees, and this is to allow for optimal healing to happen. This is slowly unlocked over the next 8 weeks until you have full range again. And while this does optimize the chance for the ACL to heal, it does come with some cons, which I'll discuss a little bit in the pros and cons section. It is also worth noting that this third option does come with a window of opportunity of 21 days post-injury. So within 21 days, you need to be fitted into this brace to allow for the best chance for your ACL to heal. While it is a new approach, there has been a bit of research to show that about 90% of the participants so far have been showing signs of healing at the 3-month mark after the brace has been taken off. And so after going through these 3 options, I want to go through a little bit of research to underpin what the outcomes would look like for each one and to help you make a better informed decision. And so here we have a paper by Stephanie Philbay, and it's an analysis on a different trial that was done, looking at the evidence of ACL healing on MRI following a complete ACL rupture through rehab alone versus surgery. And it's interesting in that it looks at the outcomes via a knee injury and osteoarthritis outcome score. And I'm going to scroll down to where the table is that has the most interesting data for us. And that's this one here. This one here talks about the 2 and 5 year outcomes following an ACL injury. You can see here on this group here, this is the rehab alone with no ACL reconstruction at the 2-year mark. These scores here are representative of the CUS, which is the knee injury and osteoarthritis outcome score. A higher, closer to 100 score is better versus a lower score. And so this group here looks at the evidence of ACL healing with no actual surgery, and their scores across the board on sport, recreation, quality of life, pain, symptoms is all really good. At the 2-year mark, it's almost better than every other group here, which involves surgery for these 2 groups there. This is a delayed surgery done within 2 years, and this is an early surgery. At the 5-year outcome mark, these 4 groups are there again, and you can see now that these scores are actually much closer together. We're looking at almost the same for pain, so they're all experiencing the same amount of pain, and symptoms is pretty close as well. So the surgery groups have actually caught up to the rehab alone groups. And so this is interesting because outcome wise at the 2 and 5 year mark, 5 years across the board is almost the same. Now looking at the benefit of surgery, it's probably this one here. This is a test that tests the ACL laxity, and obviously the ones who have had surgery, their test scores are really good compared to those with no surgery. So to round off this video, I want to share with you what are some of the pros and cons that I think around each option. So for the surgical route, the biggest pro is that your ACL is intact given that they reconstruct it. This means that you have peace of mind around the ACL and that your knee has almost no instability after it has healed. Some of the cons that I see around the surgical route would be that the initial trauma to the knee from surgery means that you have more pain and swelling immediately after the procedure. And for some people, the cost of surgery, either with money or time, is also something to consider. For the conservative route, the biggest pro is that you can avoid surgery altogether. This usually results in less pain and limitations earlier during your rehab, as we saw in the research previously. The other pro is that your function and quality of life is not limited if you have good rehab. Some of the cons to consider would be that your ACL may or may not heal spontaneously, and you will have some risk of instability around your knee if your rehab is not sufficient. And without an intact ACL, you may also have difficulty with pivoting or twisting in activities that place a lot of force on your knee. For the cross bracing protocol, the biggest pro is that you can avoid surgery and your ACL may heal as well. Although it is new, the research around it is showing promising results. The cons for CBP are that there is no guarantee that your ACL will heal. It does optimize the chance, but it isn't 100%. Also, while you are in the brace, there will be some muscle atrophy and joint stiffness due to being locked in one angle for so long. There's also a risk of blood clot, which is mitigated by taking blood thinners as soon as the brace is fitted. And so hopefully the information in this video has been really helpful for you in thinking about how to manage an ACL injury if you have had one. There are a couple of options now to consider. And one thing to say is that the surgical approach is there's no rush to do it. And so even if you were to delay the surgery to try a conservative or cross-bracing protocol method, that is okay. And if they don't work out for you and you want to end up doing surgery anyways, your outcomes would be the same regardless. The thing to remember is that the rehabilitation is always the most important part with any injury, and so it's important to find a good healthcare professional or physio that you trust to look after you and to guide you and tailor your rehabilitation to you. In saying that, I hope that you enjoyed this video and found it informative. If you could leave a like and a subscribe on the channel, that'd be really helpful and I really do appreciate it. And that's all for today's video. Thank you so much for watching, and I'll see you in the next video.